to watch their fly. Be clear across the town. That ain't gonna work. So they weren't in the room?
Yeah, Mom still has to do
That's up and down.
So both the providers are still tied up with patients.
Oh, she's good.
Whoops, that's here. Okay, now we're just missing one. Is Lori on her way?
Oh, she's right there.
Oh.
Just signing in.
Yeah.
We have 12 total. Christina's one of them, right?
Oh, she is one of them. Already.
So, I'm gonna make a couple of quick announcements, and we are gonna be recording this, and you will see a slide about that. But those of you in the room and on the phone, the first thing we want you to do is a pre-training survey that's in your packet. So it should take you just a couple of minutes. Called the Pre-Booster Expert Training Survey. And we want you to create, just like you did in the first training, a unique ID, 3 letters and 3 numbers that you remember for your post-survey so that you can use the same ID at the end of this training. Go ahead and fill that out.
Okay. Well, I guess we just got that in. Do a different one here, because you have to do a state. Do you have the state? Okay, and go over here. I guess. Yes. Yeah. I can't because my connection's not routed. Will yours let you get them?
Okay, so
You got him?
do I just go here?
No, you should be specific.
Pre-boosters crossed out.
Couple of housekeeping things, especially for those in the room. We are recording this, and it means that it's a very sensitive microphone, which means that pretty much any sound in the room will be picked up. So if you need to take a phone call or speak to someone, who's next to you, please step away from, step outside. Also, the restrooms are right outside the door to your right. And if you, for any reason during this training, need to leave the building, please grab a visitor tag that's right near where you signed in that you should wear when you go outside so that someone can let you back in if you try to get back in and they're wondering, are you here for a legitimate reason? There's a little green tag. And did everyone sign in on the sign-in sheet? And if you didn't, it's right over there. There's some food in the back in case you didn't bring your own food or you'd like some extra food. So anything else, Kevin, I've forgotten about housekeeping? Okay. So we want to again acknowledge that this project, the School-Based Health Center SBIRT project, is a collaboration between the Colorado Office of Behavioral Health, the Colorado Department of Public Health and Environment, and Peer Assistance Services. And when you finish your pre-training survey, someone will collect them so that they'll be ready to be compiled. We will leave time at the end of this training for the post-training survey. And for those on the phone, if at any time you can't hear or there's any technical problems, use the chat box. Is that correct, Kevin? To send a message, and we will work with you. This is the first time we're doing this kind of both off-site and on-site training and recording it. So we'll try to make it run as smoothly as possible, but absolutely, of course, let us know if you're having any trouble, especially those of you on the phone, and thank you for joining us, those on the phone. You can all see this, the outline for the survey, or for the training today. And there's kind of several miscellaneous topics, all somehow connected, that we're touching on, that were put together by the team that runs this project as things that would be especially valuable to focus on for the booster training. And I didn't mention, but I'm Carolyn Swenson. I met many of you, all of you, more or less, when we did the initial trainings last year. So I'm happy to see you all again. And we're really excited about how you're all implementing SBIRT in your school-based health centers. So we are going to have some role plays near the end of this training. I'm going to be very focused on keeping us on time because we feel like that's one of the most valuable parts of the booster training, to practice some skills that we're going to review and touch on today. So please ask questions throughout, and I will try to make sure that I repeat the question or the comment so that people on the phone can hear it. So we are going to very briefly touch again on SBIRT basics. We're going to talk a little bit about when could you be doing SBIRT, what types of visits, and how can you be using your whole team to do SBIRT. We're going to practice some skills, and then, as I already said, we're going to talk about things that you may want to ask about. If at any point you have questions about things that we either don't have time for or that we're not really touching on, I want to remind you that you do have a technical assistance team working on this project with you, housed here at Peer Assistance Services, and of course CDPHE can help facilitate any questions or concerns that come up, but please be aware that you can ask for help at any time, and there's a whole team prepared to work with you. Okay, you've all done the pre-training survey. So starting off, just a quick review. Of course, SBIRT stands for screening, meaning use validated questions to ask about substance use. Brief intervention, meaning a short conversation lasting just a few minutes in most cases to enhance a teenager's motivation to change alcohol and drug use, ideally back to abstinence, but harm reduction is also appropriate for that motivational conversation. And referral to treatment, meaning when an adolescent is already experiencing a more severe alcohol or drug use problem, also do a brief motivational interview or intervention, but also arrange for additional services, a range of types of services that could address underlying issues, family problems, academic, mental health, for example, connecting them to positive activities and supportive adults, but also sometimes substance use treatment is what we mean by referral to treatment. Again, and this is borne out in the data that's coming through in this project, the big three among adolescents is still tobacco, alcohol, and marijuana. And adolescents who are not using one of those big three are pretty unlikely to be using any other substances, including misuse of prescriptions, illicit substances, and inhalants, things like that. So this is where we still start and focus when we're doing SBIRT, but also being prepared for the possibility that some students, of course, will be reporting other substance use. And since the initial training, the Healthy Kids Colorado 2017 data has been summarized, and there's several data presentations, and in fact, there'll be some more focus on these data in upcoming learning collaborative sessions and trainings. But we wanted to give you a quick snapshot of what we're seeing. And Colorado is similar to the rest of the country, and in fact, on some substance use areas, Colorado is doing better, and on others doing not quite as good as the rest of the country. But orange is alcohol, the orange line. The green line is marijuana, and the blue line is tobacco. And you can see that especially alcohol and tobacco use have been decreasing in youth, going back as far as 2004. Marijuana jumped around a little bit, but overall, somewhat of a decrease. And alcohol is still the most commonly used substance among teenagers in Colorado. So there'll be more data, and there's more available data summaries, et cetera. If you'd like to see more, that's one thing you could ask for, and we could connect you to more data. Okay. So one of the things that has been studied quite intensively when SBIRT is implemented among adults or adolescents around the country is how do you do this in the most efficient way? And the answer seems to be that you use your whole team, that there's essentially a role for every member of a practice team to help carry out SBIRT. And because SBIRT tends to be a quality improvement initiative, meaning you're introducing something new, it takes some tweaking and adjustments to make it work, we really encourage that practices designate a champion who kind of is the point person, who gives updates on how SBIRT is going, who helps troubleshoot, seeks out that technical assistance when needed. And I think you can probably see the cartoon, but it's like, let's try it once without the parachute. So the champion.
I was just gonna say, we got a question on the chat. Should I hold it for later, or?
Let me just finish this thought and then we'll take that. Yeah. So anyway, having a champion can definitely streamline the implementation process, help with troubleshooting. So what was our question?
The question was, is there data included, does the data include nicotine vape pens?
The slide that I showed you did not include vaping. And that's something that you probably have all heard about, that Colorado ranks #1 in the nation on vaping. And there's a lot of effort right now to try to understand what's underlying that high level of vaping. But there's also going to be more coming up on that, even in this project, where there's some additional questions that will be asked, not only about tobacco, but also about vaping. And often teens, we already have discovered, feel like or think that when they're vaping, they're not using a nicotine based product, when actually in most cases we've heard most vape products do contain nicotine, sometimes enormous concentrations of nicotine. So there's some background work happening to make to increase the focus on vaping as somewhat related to this SBIRT project, and there's also a new tobacco project happening in school-based health centers. Anything else you want me to say about that?
So I think some of you might know, because you were part of like the Just Health Committee, that we're talking about adding specific questions about vaping, because we don't think the tobacco question is really getting at the vaping. They're not recognizing e-cigarettes as vaping. So the Just Health Committee met, and so we're proposing a new question. We're just figuring out like the responses options to keep the question validated. And then trying to think of some other things. All of a sudden it just popped out of my head of some of the other things we're working on. But there is another project going on that CASEC's leading. And I don't know that MCPN or I'm trying to remember which sites are part of the tobacco project, but there's also looking at tobacco cessation, which is in line with SBIRT. It's about tobacco counseling, which is brief intervention. So we're trying to coordinate with CASEC and sort of set some guidelines. So we'll soon have like an algorithm that would sort of coach you on like what some steps to take when somebody is using a vape product or cigarettes, or when they're exposed to secondhand smoke or secondhand vapor. Because I just learned this today. I don't know these things, but I didn't think that vapor would be, as toxic as studies are starting to show. So, we want to also educate kids about the exposure to secondhand vapor as well.
So for whoever asked that question, please let us know if that didn't answer your question. That's okay? Okay, thank you. Okay, back to implementation. So in the initial training, we showed you a slide that kind of looked like this, that focused on ways to use different members of the team. And So actually, this is exactly the same slide. So I'm showing it to you again, just as a reminder that for most steps of SBIRT, there can be a role for all kinds of different members of the team. And I know sometimes these team members have different names in different clinics, but that's a quick reminder. And then we're going to give you, let's see, a snapshot of how is SBIRT actually being carried out in some of the school-based health centers in Colorado who've already been reporting on their workflow. So you can see that on the screening column, there's especially a lot of utilization of front desk, medical assistants, and patient navigators to initiate or carry out screening, most likely, review the screening, make sure it was carried out completely. But that's a very common picture for SBIRT, that front desk, medical assistants, and people like navigators, health educators to often play a role in initiating the screening step of SBIRT. You can see that when it comes to brief advice, giving very short, focused feedback to a young person, generally who's not experiencing a very high risk at all of substance use, but may be beginning to experiment with alcohol or drugs, that often, in some cases, in most cases, I should say, it's the primary care provider who's doing that, but sometimes a health educator and sometimes the behavioral health provider is giving that brief advice. And one of the role plays today will be on brief advice. And then brief interventions, which typically apply to a bit more concerning level of risk, moderate to high risk. Primary care providers and behavioral health providers are overwhelmingly providing those interventions in the school-based health centers so far in this project. I'm going to back up one slide because this slide is simply summarizing some questions that with the champion and the whole team you want to answer and figure out. And I'm guessing many of you have already done this, but it's just a reminder that at every step there's several things to think about in terms of carrying out SBIRT. We're going to talk in a minute about what types of clinic visits could be appropriate for delivering SBIRT. Who's going to initiate the process with the screening step? What about the privacy? Not only making sure there is privacy, like for students to fill out the screening questionnaires where they feel like it's private, no one's looking over their shoulder, but also clarifying the confidentiality parameters around this being a private conversation that is only that confidentiality is only broken in the case where you find that a student is thinking of hurting themselves or another person or is being victimized. Who reviews and scores the results and does the first look at the results of the screening? Decisions around brief interventions. Who's actually doing them? Where are they done? At what point in the visit? Is there a standard format being used? For example, following the pocket card. How is it documented? Especially considering how can you document it in a way that other members of the practice team can look at that documentation and kind of understand exactly what happened, what the plan, the goals, the next steps are going to be, what's the plan for follow-up? Has that been documented? For referrals, for students with a more serious substance use issue, who actually initiates that referral and figures out with the student what kind of referral should we do? Will it be internal to behavioral health potentially, or external to an outside community agency? You have a resource list of current programs and services in your community that you could refer students to. What's the protocol for coordinating a follow-up? Checking in to see that the referrals are actually happening. How's billing going? The documentation for billing, do you need technical assistance? There's a new entity that can provide technical assistance to you on billing, and who codes and who kind of tracks how your coding is going to make sure that it's meeting the criteria for reimbursement. And then quality monitoring. Is your workflow working? Do you need to tweak it? Are you doing brief interventions with fidelity to the model that's been tested with SBIRT? And you'll get to use a tool today when you role play that's focused on monitoring fidelity to a brief intervention. And then a few other areas that are worth tracking as part of your workflow decisions. Okay, so there's a screenshot up there right now that is from the Adolescent Expert Toolkit that was developed in Massachusetts with some leading pediatric substance abuse prevention specialists and treatment specialists. And they say that screening for alcohol, marijuana, and other drug use should be done definitely at annual visits, along with whenever a student may present for things like injuries or other high indicators of high-risk behaviors, such as needing to be tested for a sexually transmitted infection or for pregnancy, for example. But also you can screen whenever a teen presents with a behavioral or mental health problem, and for acute visits. And when a student has missed routine adolescent visits. So basically there's almost no type of visit that's not appropriate for screening to be carried out. So we wanted to present that as a way to encourage that you think as part of your quality improvement initiatives about finding opportunities to screen those who've missed what would have been routine screening. So any conversation or questions or feedback from how this is going in your sites, how you're already approaching finding any opportunity to do screening. And those on the phone, feel free to send chat messages to us as well. Yes.
I'll speak up.
Sure.
So we pretty much do this. I mean, I'll specify the acute visits that we do them on is more like teen confidential, because we feel that teens who are sexually active tend to be more prone to behavioral health issues. However, that being said, because the laws of confidentiality for accessing confidential services, reproductive health is any age, but behavioral health is 15.
Right.
It's a challenge.
Yeah.
So we've actually ceased doing it because we were basically screening kids that we could do nothing with. So it's like, if you can't do anything, then don't ask, is what we've decided for now with our policy. I would love to see that change, because these kids are, the younger they are, the more at risk they are. And so they were all coming back positive, but then we couldn't do anything.
And of course, substance use and behavioral health often overlap. Even though substance use, they can initiate treatment at any age. So absolutely, we hear you that creates a dilemma in our state. Were you going to add to that?
I was just going to say that there are other states that have a lower age for consent. So like Washington State, I want to say it's age 12 or 13, and Colorado it's 15. And I know there's legislation to try and change that. But right now we're just kind of stuck.
I believe it's going to be reintroduced in this legislative session. Anything from the chat? Okay. Any other comments on this?
A thought in that would be we could do substance use screening, so run a craft. And I never thought about that, just separating it out and not using our tablets that we have, which is frustrating because there's such a wealth of information.
You could do the craft on the tablet without doing the.
Right, you could just do the straight craft.
Yeah.
And perhaps we could do that much at least. It seems like, I mean, I've actually had teens come in and tell me, I am so depressed, I am so sad, and I'm almost like, don't tell me you're 13, I don't want to know. Because then I can't do anything if they don't want their parents knowing.
Yeah, then there's that for both mental health and substance use, the fact that most teens are more likely to get the help, get to an appointment or get the help they need with all kinds of issues if their parents do get involved and help coordinate and support. They need support, but it's a dilemma, isn't it? Okay. I'm going to move on unless there are any other comments on that issue. Okay.
12.
Okay, so one of the important features of this project is that it's devoted to closely following culturally and linguistically appropriate services, also known as CLAS. And you do have in your packet an outline of the national CLAS standards that are being adhered to for this project. And basically all of the separate standards feed into the overall principal standard to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. Now, class, turns out, is quite a comprehensive and fairly complex thing. So one of the things highlighted on this slide is that there's an expert on class who's available to help you in your school-based health centers determine that you are adhering to class standards and offer technical assistance when needed. And in general, everything about SBIRT is designed to be culturally and linguistically appropriate. Just a couple of quick examples. The craft, if you didn't already know, it has been translated into many, many languages. I don't want to, something like 70 or more. So chances are, if you encounter rather, unusual languages or less frequent languages, there's a good chance the craft has been translated into it. We understand that cultural, community, family attitudes and practices around substance use varies, and that's why the approach to brief interventions is designed so that you always engage with the individual and potentially family as well about beliefs and practices. What has the young person grown up around in terms of alcohol or drug use? And you always want to get their feedback in the conversation on what they think, what do they know about substance use. And one more example would be the terms we use to talk about alcohol and drugs. And there will be more coming on that because, not surprising, and you probably all have a lot of experience with this already, things change. What was a term 5 years ago is like no longer used. And it's important that we keep up on that. So that's another example. And there's many more examples, but please know that there's expert help to help you all adhere to class standards. Any questions or comments on that? Anything in the chat box? Okay. All right. So like I said, we're kind of jumping through several categories of conversation today. So one of the things that we thought would be worth reviewing again, because we know that you have many things you have to deal with when you see a student. Often there's multiple issues, not just one thing, is to review quickly for substance use, how do we classify risk? To help you figure out how urgent is the problem. It's more than a little bit different than depression, where you have the suicide issue that always rises to the top, of course, and makes something imminently urgent, right? Substance use isn't quite the same way. So we have a few slides and just a quick review of ways to help you think about what level of risk are you looking at when you now have a craft score and a student who's male or female and of different ages. How do you figure out what level of risk you may be looking at? So in general, and this primarily comes again from the Massachusetts guideline on adolescent SBIRT, which is a tool that's accessible to you on the resource section of the CDPHE website. So in general, regardless of age, gender, health status, other things you may be thinking about around your student, an individual who reports never using substances and no current use has a very low risk for experiencing problems related to substance use, but it's still an opportunity to give praise and positive reinforcement, which has been shown to actually be an intervention, an effective intervention that helps teens delay substance use as long as possible throughout their teenage years. And we're going to try this out a little later in the role plays. When you do this praise and positive reinforcement, it's especially valuable to ask the student to tell you their own reasons for not using alcohol or drugs at this point in their life, and potentially ask them to think about how would you respond if someone urged you to use alcohol or drugs or offered you, alcohol at a party or marijuana at a party. When you identify a student of pretty much any age who's reported once or twice in the past year that they have tried out alcohol, marijuana, tobacco, vaping, generally it's low risk, and it still warrants some intervention, which we typically call brief advice. Not necessarily a full-blown motivational conversation, but clear advice about the importance of abstaining from alcohol or drugs, mentioning, you know, health and other risks, especially around their developing brain and, you know, their future goals, things to do with academics, for example, and finding out what they think about that, making it a bit of a conversation. Many members of the practice team could carry this out, and it could be documented. It can be documented. There's a way to document it in Just Health. Monthly use is generally considered moderate risk, that warrants the brief intervention, the structured motivational conversation carried out by some member of the practice team, often with setting a specific goal and encouraging a trial of abstinence if the student is willing. If there's the car question has been answered positively, making sure that they have the contract for life or some other approach to keeping them safe around driving a vehicle or riding in a vehicle if someone has been using alcohol or drugs. As soon as you find weekly or more frequent use at all ages of teenagers, you're looking at what we would consider high risk, meaning not that they necessarily already have a full-blown DSM-5 or ICD-10 substance use disorder, but rather that they're at very high risk for progressing to increased alcohol and drug use and a diagnosable substance use disorder and very negative consequences of alcohol or drug use. So that teen should receive a brief intervention and some sort of referral to additional follow-up and services. It could range from mental health services to substance use treatment, positive youth development opportunities, academic interventions, family, working with the family, a whole range of things. And even multiple brief interventions is considered treatment. So you might meet with the student once a week for several weeks to continue the brief intervention conversation. Any questions about this way of thinking about risk? There's another couple of slides on risk levels. This one particularly pertains to alcohol use, which again is the most common substance still used by teenagers in the United States. And the National Institute on Alcohol Abuse and Addiction has actually been able to study how much frequency of use in the past year predicts a future serious alcohol problem. And you can see that it's very age-based. So let's look first at high risk. It's kind of clear cut. If you find an 11-year-old who's even once in the past year reported drinking alcohol, you're looking at high risk. Those teens have a very high probability of progressing to a more serious substance use problem. From ages 12 to 15, only 6 days in the past year of drinking alcohol is considered high risk. Ages 17 and up, 17 to 18, I should say, 24 days in the past year, and at age 18, 52 days in the past year is considered high risk. Moderate risk, you can see on the screen, ages 12 to 15, 1 day in the past year is already considered moderate risk, predicting a trajectory of increased alcohol use, leading to a more serious problem that could put them into the high risk category. Ages 16 to 17, 6 days in the past year is moderate risk, and age 18 to 21 is 12 days in the past year. So that's another way of thinking about risk when you are actually interviewing a student about their alcohol use. And then a reminder that there are different definitions of binge drinking for girls and for boys throughout the teenage years. This is based on estimates of at what point would the young person become intoxicated, the average girl throughout adolescence, the average boy of different ages. So you can see already in adolescence, these binge drinking levels reflect that females are born physiologically more vulnerable to alcohol, with lower levels of the key enzyme that metabolizes alcohol, so that the alcohol remains at a higher concentration in the female body than in the male body. And so already at age 9 and up, they've estimated that girls would become intoxicated at 3 drinks or more. And of course, teenagers typically binge drink, and they frequently drink more than these low limits, these lower level limits. So it's quite common and high risk for a teenage girl who's going to be drinking, binge drinking, that she would reach intoxication and even reach very dangerous levels where she might black out all the way up to age 17. For boys, 3 or more drinks in a sitting is binge drinking up to age 13. From age 14 to 15, it's 4 or more drinks in a sitting. And boys reach the level of 5 or more drinks in a sitting at age 16, which is expected to lead to intoxication, which is the same as the binge drinking level for an adult male. So that's helpful information not only for you to determine level of risk, but also for giving feedback to a teenager around if they're ever drinking, how do we help keep them safe from binge drinking that could result in intoxication or worse, blacking out and even death due to alcohol poisoning.
Question for you.
Sure.
I just had a male, 18-year-old, 102 pounds.
Oh.
I mean, what are the guidelines, weight-related guidelines?
So these guidelines incorporate especially basic physiology, but you're absolutely right that body size, health status also plays into it. So a very slight boy, I would say, typically, the typical boy, you'd expect you to become intoxicated or also known as drunk. At this level of alcohol, you might even be more sensitive to alcohol. And of course, habituation is the other thing, because all teenagers, when they first start to drink, of course, are brand new. They haven't been exposed to alcohol before. And over time, especially if they drink more, will start to become more tolerant to alcohol too. But I think you're right that it would warrant saying, I'm even a little more worried because you don't weigh very much. And so alcohol could have even more effect than it might on your friend who's 150 pounds or something. Yes.
What's the time range on a sitting?
Yeah. It's typically been defined as about 2 hours an occasion. And this is something we always run into. And what we basically say, first of all, because adults and teens tend to drink in episodes, they don't space the drinking out over a whole day, that it's sometimes easy to start off with in a day, how many drinks have you had? But then when you're getting more precise, it's technically around a 2-hour period of time. Does that make sense? When we ask adults about drinking, we just say, what's the most you've had in a day? Or when's the last time you had 4 or more or 5 or more drinks in a day? Knowing that most adults cluster their drinking in a time period that's, around 2 hours or so. There's a few more high-risk indicators that, in addition to the frequency and quantity of drinking, would help you figure out how much risk are you looking at. We've already talked about weekly or more frequent use, extreme binge drinking, polypharmacy. Just a reminder that, of course, it's not uncommon that teens may use multiple substances at the same time or in the same episode of substance use. That's always increases the risk of interactions between the substances. Even one-time injection drug use is considered a higher risk situation that often needs more investigation and sometimes additional follow-up, such as infectious disease testing. A significant drop in school performance. It turns out that academic performance and academic indicators are one of the best ways to determine if a teenager is starting to develop a severe substance use problem. It's often the predictor that the problem's getting worse, and it can be bidirectional. Doing worse in school can lead to more substance use. Obviously, more substance use can lead to doing worse in school. Co-occurring mental health disorder always increases the situation to a higher risk situation. Any illegal behaviors to obtain alcohol or drugs or while under the influence of alcohol or drugs. And then making sure we think about a wide range of safety concerns, not only the driving, but also biking, snowboarding, skateboarding, those scooters that you see people riding around a lot, at least in urban areas right now, and victimization. Are they at risk of being taken advantage of or harmed by another person? Okay. We emphasize also that for all teens at all levels of risk, it's really important that we think about what protective factors that they have in their life to help them stay substance-free or help them move in the direction of less substance use if they're already using substances. And protective factors relate to family, school, and community. And ideally, a teenager will have some elements of all of these in their life. And of course, some teens will be missing or have more troubled situations in their family or school setting, for example, where we need to kind of make up for missing protective factors by finding other options for them to help protect them. So the key elements of these protective factors that promote positive youth development are helping teens have supportive relationships, at least with one trusted adult in their life. Opportunities to build their skills, to identify what do they like, what's important to them, what are their goals, and get to work on those things. And then opportunities to contribute, to give back to their family, their school, their community. So just a reminder that this can be fairly structured in your SBIRT work to help teens and really make it a deliberate part of your conversations and follow-up. Okay. Pause. Any questions in the room, on the phone? Kevin just stepped out, but you probably would have told me if there were any. Okay. All right. So next, we're going to talk a little bit about motivational interviewing, which I know is a familiar topic to many of you, probably all of you already. We thought we'd highlight some things about motivational interviewing that especially contribute to making SBIRT successful. Okay, I'm going to let you read what's on the screen while I take a quick swig of water. So that's just sort of a simple lay definition of, what's really happening when we use motivational interviewing, whether it's with a teenager or an adult, whether it's related to a health issue, a health behavior issue, or just some other choice that a person could make about a behavior. So there's an old saying in the motivational interviewing world that when we use motivational interviewing, we're actually slowing down in order to go faster. By kind of slowing down and having a true conversation with the patient, we typically help them reach the point of making a change to improve their health or other parts of their life faster. So that's kind of what our goal is in motivational interviewing. And just a reminder on this slide of the key points that have been studied and shown to work. It's basically what makes motivational interviewing effective. The first is to show genuine empathy. Even if you don't agree with someone's perspective, like they say, this is no big deal that I, smoke weed several times a week, it's not affecting me, it's not going to hurt me. We genuinely try to understand that perspective, even if we don't agree with it or endorse it. We collaborate. We really tell the person, we want to work with you on this, figure it out together to keep you healthy, safe, help you succeed at school. We elicit self-motivational statements, which literally means, we might say something like, as your health provider, I'm really interested in helping you stay alcohol and drug free for your health and your future. What might be some of your best reasons to not smoke marijuana or drink alcohol? Because the more that a person finds their own best reasons to change, the more likely they are to actually eventually change and decide it's worth changing. We respect autonomy, and this is especially a valuable principle in using motivational interviewing with teenagers, because we get to say very clearly, it is your choice what to do. I want to help you stay safe and healthy, but I understand that it is your choice to not use alcohol or drugs or to use alcohol or drugs. And this is also very valuable when we find someone who's quite unready to change. We can affirm autonomy as a way to keep the door open to further conversation. We reinforce self-efficacy, many adults and teenagers are reluctant to try to change because they're already thinking ahead to how hard it's going to be. They're not sure, what am I going to do instead when I feel stressed if I'm not going to vape or smoke marijuana? What am I going to do when I have an argument with a friend or one of my parents? So we have to really bring out into the open that we believe that they could change and that it might be difficult and they might have to try multiple times, but we believe it's possible. And our belief in someone's the possibility and the potential for change is a self-fulfilling prophecy, basically. It helps the person get closer, faster to believing they can change and to being successful. And then there's a few things that are clearly not appropriate parts of motivational interviewing that tend to make us go in the opposite direction and drive a person away from change. And those things include confronting them, especially if we think they're not telling the truth, for example, or if giving them advice without their permission. So just making sure we remember to say, would it be okay if I shared my perspective on this, or let you know why I'm concerned when a teenager is drinking alcohol, even a little bit occasionally. Prescribing specific approaches to change, telling them, I think instead of vaping before the test, you need to do some deep breathing. So we don't prescribe change to them, but we work with them to figure out what's going to work. So those are some key points. And I know a lot of you, yes, please.
So if you ask them permission and then they say no, then what?
Yeah. First of all, we've had a lot of opportunity in the expert world anyway to find out how often does that happen. And it turns out it's really rare, which is good news. We think it's partly because people are a little curious. You know, we sort of don't give away what we're going to talk about. We're like, would it be okay if I shared my perspective on this? Or would it be okay if I told you what I've sometimes seen happen when the teenager just starts out with a little bit of marijuana once or twice a week, you know, and they're kind of curious, but also we're truly giving them the option of saying no. And if someone actually says no, what we counsel people when we're teaching expert is that you respect that. You let them know that you were concerned, like, well, I was concerned and that's why I wanted to talk to you, but I respect that right now you don't want to hear this. And at any time, I'd be very happy to share my concerns with you or work with you on this, something like that. Any other questions? Okay. Okay, so there's another thing in motivational interviewing that tends to be, at least I can speak for myself, one of the most challenging things, which is to roll with resistance. And so the image on the screen is just, for me, it kind of evokes rolling, like waves roll and I have no control over them. And the idea in motivational interviewing is that when we do encounter reluctance to change, that's sometimes known as resistance, you know, sometimes pretty strong, pushback is another word we'll sometimes hear, is that our impulse is to sort of like just slightly change our way of talking about the issue, like, you know, say, well, let me put this another way, why I think you should stop using marijuana or stop drinking. And the idea in motivational interviewing is literally that we let it go. We let it roll off our back. That's an image that some people think of. And I think the simplest way to think of it is we slightly change the subject. We acknowledge that they're saying, you know, I could never give this up. I could never change. It's what helps me get through school or life right now. It's like, okay, I hear you. So what should we talk about instead? What should we focus on instead? What new skills might you be interested in learning? We just change the subject slightly. And we don't ignore that the person is saying, I absolutely could not do this right now. So that makes sense. It's kind of hard to articulate, but you kind of feel it when it's happening. And for most of us, many of you may not have this happen to you, but for most of us, when we get that resistance or pushback, our first impulse is to just try to present a little better argument or more reasons that we think they should change. And that doesn't tend to work, okay? And it kind of catches people by surprise when we don't push back because they're kind of expecting it. They're sort of waiting for the lecture to get a little more forceful. And instead we're like, okay, well, let's focus on something different right now then. essentially what we're saying. Another part of motivational interviewing that's really important is to listen for change talk and to focus on change talk before we get to all the focus on barriers to change and how we're going to help someone change. And the reason for that is that when people talk out loud about change, it directly predicts how likely they are to eventually change. And until they get to a point of committing to making a change, they're unlikely to actually take the next step. So we're sort of wasting our time if we begin to focus on the barriers, the challenges, what will be hard, what might help them get there. We have to help them get first to the point of being ready to say, yeah, I think it would be a good idea for me to drink alcohol less frequently or stop smoking marijuana right now. So change talk is typically defined in kind of 4 main categories: desire, ability, reasons, and need. So I'm going to give you just a quick example of what it might sound like when you hear a person giving you these types of change talk. I wish this wasn't happening to me right now, that I have to miss 3 basketball games because I got caught smoking weed after school. That's a desire for something to be different. This next one, ability, might be something we hear fairly often from teenagers. I can give up tobacco anytime, or vaping. Not a big deal, it's just mango flavored. Anytime I want to stop, I could do it, no problem. That's ability, which is good. They might not have as easy a time as they think, but that would be an example of ability that we want to pull out and say, well, I'm really glad that you're confident you could change. And then we move on to, so what might be some reasons to think about change and making a change in this? Reasons, very straightforward. The more reasons a person can list for making a change, the more likely they are to eventually change. And it's worth, when talking to a teenager or an adult, to say, so even if you're not ready to change this right now, what are some reasons you can think of that it might be a good idea someday to change? And let them, give them a little time to think. If they have no reasons, we can always throw out a few examples. Like for some people, they think it's worth not ever drinking or using marijuana at school because they wouldn't get in trouble. They'd avoid getting in trouble. I don't know if that would apply to you, but that could be a reason. What do you think? Or not disappointing your parents. Turns out many teens actually really care about that. They don't want to disappoint their parents. Staying, extracurricular activities, losing privileges is another reason that someone might want to change substance use. Need is often defined as just a sense of urgency. I need to get this under control, or I need to find a better way to handle stress because this isn't working for me. I really need to get my grades up because I really want to get a scholarship, really want to get into the military. So kind of urgency. When someone recognizes that something bad could happen if they don't make a change. So we want to encourage change talk, and when we hear it, we want to elaborate on it. We want to say, okay, I hear you listing a number of reasons that it might be good to quit drinking. So what's the next step you might want to take? Tell me more. How would your life be better if you made this change? Let them talk about change. It directly predicts that they will eventually change. So one of your handouts in your packet today, and it's really hard to see this on the screen, but I want you to know you have it in your packet, is compiled from the sort of founders of motivational interviewing, Rolnick and Miller, and it's called 10 Strategies to Elicit Change Talk. And some of these strategies are actually built into the structured motivational conversation structure that you have on your pocket card for SBIRT. Some of them might be a little less familiar to you, but I'll just highlight 2 or 3 of them, but I wanted you to have this as an example of things you could try in a conversation about any change topic. Asking just open-ended questions. Why might you want to make a change in you're in drinking alcohol at this point in your life. That's getting at desire. How might you go about doing it? If you did decide it was a good idea to not drink, how would you go about it? How would you respond if your friends urged you to drink? Or the next time you're feeling really frustrated, how would you approach that feeling rather than using marijuana? What are some of the best reasons you can think of to change your use of alcohol or drugs? How important is it for you to change right now? How might your life be better? Another one, a strategy that tends to be really valuable in conversations around alcohol and drugs and with teenagers is the second one on the list, explore the pros and the cons. But this it's called decisional balance. It kind of brings ambivalence out into the open, because there's usually some good things about change and some not so good things. There's some good things about using marijuana or alcohol or tobacco or vaping, and there's some not so good things. So this literally lets them talk out loud about those good and those not so good. So what do you like about drinking? What does it do for you? That's the good. What are some of the not so good things about drinking? What would be some of the good things about changing? What would be some of the not so good or kind of difficult things about changing? And this strategy has really been shown to work with teens and adults, but especially in these ongoing motivational conversations with teenagers to help them change substance use. Let's see. One more that I'm going to highlight here, then you can look at the others, is to use the change ruler, the 0 to 10 ruler. It's on the pocket card, and I know we've practiced it in the initial training, but it tends to be a really quick way to kind of get to the point on how ready is this individual to actually change. Where are you at right now, and how ready you are to give up drinking, to change marijuana use. And people choose a number, whatever number they choose, from 0 to 10, where 0 is not at all ready and 10 is very ready. We come back and respond by saying, so what made you choose that number and not a lower number? As a way to evoke more change talk, okay? So even if they choose a really low number, like a 3, you say, okay, they're not super ready to change your marijuana use. What makes you a 3 and not a 1 or a 2? And people tend to talk about some reasons for change, even if they're not ready to do it yet, okay? Okay, so the brief intervention that we offer for moderate risk or higher in substance use conversations in SBIRT is using motivational interviewing. And the pocket card, I don't know if you brought your pocket card today. Do we have them in the packet? Yeah, we do. So you have an adolescent pocket card. Want to hold that up, Christina? And those of you on the phone, we hope you have one handy, but it's online. It's just a mobile version of it as well if you don't have it handy. But we outlined a sort of standard approach to the short conversation, the brief intervention, and each step is using motivational interviewing principles and techniques. So again, just a quick reminder that when we're doing this short conversation, this is typically a sequence of the conversation that tends to work pretty well. First, we want to review screening results. Make sure that they understood the questions they answered, that the responses reflect what they actually are doing in their life currently. And if they change their answers when we're reviewing them, we would update their craft responses to reflect their actual answers. We correct them if needed. Then we want to take a moment to make a clear statement around abstinence being best for health, safety, and future goals. And the reason this is so important, even though it kind of feels a little bit directive, is that we want to make sure that they hear a clear message that as a health professional team member, we know without a doubt that staying alcohol, tobacco, drug, and vaping free is the very safest and best thing for their future and their health. So they cannot, if we end up talking about harm reduction as a strategy, that they don't misinterpret that harm reduction conversation as kind of giving permission to use alcohol or drugs, so long as they don't do it at school or do it too often. So don't hesitate to give a clear recommendation of no alcohol or drugs. Ideally, we want to address driving and riding in a car risk with all teens at any level of use, from abstinence all the way to already using alcohol or drugs and maybe even already having a driver's license, as a way, and it has been shown to help keep teens safe when they find a trusted adult to make an agreement with, so that they have someone to back them up and help them out. Are you using a contract for life? Okay. So we always want to elicit self-motivational statements. So if they're not using alcohol or drugs, like I said earlier, give them the chance to talk about how they would respond if someone offered them alcohol or drugs. Ask them to talk about their own reasons right now for staying alcohol or drug free. And then we want to always reinforce that self-efficacy, that, you know, change is hard, but we can help you. We know it's possible, and we'll work with you on this. So that's the Pocket Card, and it's the same, hasn't been updated, but there's nothing that's incorrect on it. I just have to point out that sometimes in adolescent ESPERT, you can see on the reverse side, there's the 4-step motivational conversation. Sometimes we sort of add a little extra step at the beginning, which is to spend a little more time exploring their reasons for alcohol or drugs, kind of calling that out as a really specific part of the conversation. Yes?
I think I'm still thinking about the last slide that you had up. Just number 2, recommend no alcohol, tobacco, or marijuana or other drug use, which is obviously like what the ideal of what we would want. But it makes me think a lot about like sex education and saying abstinence is best, and then kids are just going to stop talking about it, just stop telling you, or identifying that they're engaging in high risk sexual activity. So I guess I'm just wondering, as a follow-up to this, knowing that that's not always going to happen, that this is actually an ideal and not necessarily something that most teens are going to commit to, if that should be followed up by saying, and if you make the choice to use, these are some strategies that you might implement to create a safer situation for yourself.
Yeah, thanks for asking that, because I think here's how I would imagine it happening, and please let me know if this is not realistic, is to say, you know, kind of as your health provider, as your nurse, whatever your role is, just need to let you know that we know that the very safest thing and best thing, ideally, is no alcohol or drugs at this point in your life. And then we always would say, what do you think about that? Or how would that work for you? And sometimes we already know they are, you know, using alcohol or drugs, or if with sexual activity, we already know they've already been, you know, getting birth control, for example. We would say, we would make it real. You know, like I realize that you're at a different place than that. I just, you know, I feel like I need to let you know that we still know that that's ideal. What do you think about that? So we try to make it conversational, and then they say, you know, I'm not going to give this up, or I'm not going to change, basically is what we hear. Then we say, well, would we be able then to talk about some approaches that make it as, that decrease the chances of something really unfortunate happening to you because of alcohol or drug use, like it getting in the way of you finishing school, or you get injured, a really serious injury, or even, you know, kids get killed when they are under the influence of alcohol or drugs. So that's how we would approach it. We wouldn't kind of dictate it and then just move on without saying, what do you think? How do you feel like this applies to you? Where are you at with this? And maybe others have examples of how they might approach this. But is that at all clarifying?
Yeah, it just felt really rigid.
Yes, thank you for asking the question, because I think it's tricky, isn't it? Because it's almost like we're obligated sometimes to say certain things, to warn, basically, in healthcare. But we're also then totally acknowledge that the reality may be different than the ideal.
I get to that point where I say that, but that is not the first thing out of my mouth, that's for sure.
Yeah.
So I talk about all kinds of the other things that are related to their use. And then, you know, I let them know, as your medical provider, I highly recommend that, you don't smoke marijuana. But that's way down the list after we've gone through everything else.
And this wasn't necessarily intended to mean all these would be in this sequence necessarily. They're sort of like touching on some key principles. So I apologize if it looked like you'd always follow, I guess you'd always review screening results typically first, but these others would be kind of woven in at your discretion. Yeah, so sorry if anything was confusing in the slide. Any other comments on how you might approach especially that recommendation of abstinence, or at least noting that there's, you know, I think it's partly that to make sure that teens understand it's not just like we're saying, don't do this because it's illegal and we don't want you to, but that there are actually reasons, health reasons and other reasons that clearly show that it's the ideal. Any chat box comments on that one? Okay. That's the pocket card. And then there's just a couple other things. I'm curious, you already said you're using the contract for life, at least some of you are in your settings. Anyone using the abstinence challenge so far? You nodding yes?
Yeah, we are. The name
I know.
think needs to get changed. It's just not, it just gets a bad taste before you ever get into it.
Yeah. You know, I hear you. And in fact, let's put it on our list of things to do. I'm just saying it out loud so we make sure we do it. To the best of my knowledge, this tool is not like a branded tool. Obviously, it doesn't have much design or anything. We will check in. I know the person who kind of introduced it and developed it and uses it a lot, Dr. Sharon Levy at Boston Children's Hospital. She's developed screening tools as well. So let's check into whether, you know, is there a softer term or a different term? Do you have any suggestions?
I have 3 points with all of these.
Oh, of course, please.
One issue. The other one is I would love one that's like a nicotine challenge, because that's not part of this, and I think it's kind of separate.
Yeah. Okay.
And then the third thing is, the other one, the contract for life,
Yes.
it includes an abstinence challenge. I would like to get that out of there and just have a contract for life, which is about the activity of driving or using some kind of, and separating them, because we could do this too, but not, I'll make them sign for everything.
Yeah.
And one, then it's like less likely they'll sign it.
Okay. Are you noting any of this, Christine? Okay. Yes.
You know, these are things I've been wanting to work on.
Right. And actually, the Colorado School-Based Health Project, from all that we can tell, is really pretty advanced in terms of what's happening in the country. So I think we have the opportunity to test some tools, modify tools. So if at any point the rest of you or down the road you have additional suggestions for us, please let us know. But I agree with you that these aren't perfect. Any other comments on the abstinence challenge? I just want to make sure I didn't cut anyone off. Were you about to say something? Okay. I did want to note that in addition to truly being like just a trial, would you be willing to try this? We'll both see how it goes. It sometimes, remember, serves as a wake-up call for some teens who are actually getting to the point of having a fairly serious substance use disorder and aren't acknowledging it, or they just really actually don't recognize it because they haven't been through this before. So, in the case of vaping and nicotine in general, that can often be the case too, because they're very convinced, like, oh, no one gets addicted to nicotine at this point in their life. And so it's like, okay, let's just see how it goes. Try a week without any vaping or nicotine. And it sometimes was like, wow, it's a lot harder than I thought it would be. Okay. We already talked about the contract for life, and we will look into both of these. There's one thing that we're introducing to you as it's in its earliest form. It's also adapted from the toolkit I mentioned earlier, developed at Boston Children's Hospital. But for a couple of reasons. One is to just simply give you another idea of a tool that you may already have some things you use that are similar for health behavior change. But it's also been shown that teens do better if they, A, have some really concrete goals and some way to have it documented, like on their phone, on a piece of paper, something that kind of reminds them, jogs their memory. So this tool, we totally, again, welcome all your input and ideas. would be to, first of all, kind of acknowledge where they're at right now, the day you're having the conversation. You are drinking a little occasionally, not very much. You're not using any other substances, and it gives you a chance to reinforce positive choices. And then this is even alluding to that statement of, you know, the best thing would be no alcohol or drugs, but this is my doctor, and we could change that to my health team or whatever you think would be the best term that would resonate with teens, recommends that I stop, but instead, for now, and then you come up with some concrete goals, harm reduction goals, and then you write down the follow-up. So thanks to Kevin, sitting in the back there, for kind of this initial design adapted from this toolkit from Boston Children's Hospital. And we would be happy to work on creating something and see what you think. Hear your ideas, okay?
Can I just say one quick thing about that?
Sure.
So where it says, like, my doctor recommends to stop, but for now I will, I like the concept behind it as far as, like, trying to get it to that 0 point. But if you're also trying to make a change plan, just from working with kids, that's already like a failure. Like, my doctor recommends I stop, but I can't, they're already failing. So figuring out some way to make it where it's actually more attainable, and then maybe at the end be like, to continue working towards 0, but something where they're already set up.
I like that idea. So we'll probably even try to find a way to prompt you to give us some ideas and feedback, or maybe come up with a couple of trial versions and see if different school-based health centers would like to try it out, something like that. Okay. Just want to make sure you all are reminded. I have a feeling you already know the quit line in Colorado now accepts people age 12 and up. It has coaches especially well prepared to work with teams, so I want to make sure everyone's aware of that. This is a very busy slide, but just to highlight codes, reimbursement codes on tobacco, alcohol, and other substance use that will be tracked in the project. And I already mentioned earlier that there's specific expert technical assistance available to your school-based health centers on reimbursement coding, okay?
Hopefully you'll be hearing from Tony if you're interested. We have time now this spring to have RT Welfare come work with your agency if you want technical assistance on billing and coding. But I only have it through June. So if you're interested, it's available now.
Great. Okay, so we're actually doing great on time, and we should be able to do the activities that we want to do. So anything we haven't talked about that you were hoping we would talk about, or any additional questions or comments? Okay, so let me describe what we have planned for the role play part.
Sorry, I just wanted to let those of you that don't already know, there's a few sandwiches in the back.
Yeah.
Over lunch.
So everyone feel free to grab food.
And then one last thing, we had 2 people that did not create a unique training ID. So I'm going to pass these around. If you can maybe take a look at like the date and see if you can notice from your handwriting who maybe didn't do it, and then create one for us.
Followed by 3 numbers, and then remember your ID so you can use it on your post-training survey. Okay, so first of all, I'd like you to pull a couple of things out of your packet.
The ones of us who were needing to do it weren't hearing you because we were like trying to figure out whether we had or hadn't. How do we create an ID?
3 letters followed by 3 numbers, like ABC 1, 2, 3, but don't use that. Yeah, just any 3 letters followed by any 3 numbers, and jot it down.
First, no, last.
In preparation for getting ready to describe the role play activities, I encourage you to pull out of your packet 3 things. Your adolescent pocket card,
I think they're just trying to
meaning this. your copy of the craft, just so you can have it as though you were really like looking at the craft, like or the craft responses. And the third thing is called the Expert Proficiency Checklist. And it's, I don't know, it's hard to see from here, but it looks like this. For those of you on the phone, we know that you may not have a group to role play with right now. And so we apologize that you can't fully participate in this part of the activity, but we do want to note, as a reminder to everyone in the room and on the phone, that there are online simulations through the Cognito company. One is specifically 3 scenarios with an adolescent patient who's using substance use. And nurses, physicians, psychologists, social workers get CE credit. So that's an example of a sort of role play type activity that anyone in the room or on the phone can do. So for those in the room, we're going to use these tools as part of the role play. Initial training. So they're still around and they still need some brief interventions to help them change alcohol or drug use. Tyler's still in 10th grade, just like he was last year, and he's an average student. He plays soccer, runs cross country, likes skateboarding. Sports are really important to him. He has no idea about his goals beyond high school. His parents are divorced. He's an only child. He lives with his mom, spends weekends with his dad. He has well-controlled asthma, but he's otherwise healthy. So that's just a quick introduction to what you already know about Tyler from seeing him as a patient previously. Savannah is a girl who's 14 in 9th grade. She's always been a good student. She feels awkward in social situations. You probably just kind of picked that up from talking to her in the past or observing her. The transition to high school has been a little difficult because she just moved to Colorado from another state. She lives with both of her parents and a younger brother. And you're going to find out, or you have found out in the social history, that she's made friends, especially with one other girl. And you're going to find out that she's been around alcohol a little bit. She's had some opportunities to drink at this point. Okay, so we have 4 role plays. We're going to have you divide into groups. We'll have you count off in just a second. And Kevin, Stacy, and I will be facilitating your groups. You're going to have 4 opportunities to actually interact with Savannah or Tyler, and your group facilitator will tell you if you're speaking to Savannah or to Tyler. In the first activity, you're going to be speaking to Savannah or Tyler after they've filled out their craft, and they have a totally 100% negative craft. No pre-screen questions answered as reporting alcohol or drug use, and no positive craft questions, including they said no to the car. So totally negative. In the second role play, you're going to have Tyler or Savannah each have a score of 1 on the craft. I'm sorry, a score of 0, but they both reported in the pre-screen a little bit of alcohol or marijuana use in the past year. In the third role play, you're going to find that Tyler or Savannah has a score of 1 on the craft, meaning they answered 1 of the 6 craft questions as a yes. For Tyler, it's going to be that he sometimes uses alcohol or drugs while he's alone. For Savannah, she sometimes uses alcohol or drugs to relax, feel better about herself, or fit in. And on the fourth activity, Tyler and Savannah each have a craft score of 2, okay? And you can see on the screen, and your facilitator will remind you what their craft score looks like. But Tyler uses alcohol while alone, and he once got in trouble. Savannah uses alcohol or drugs to relax, and she once forgot something that happened while under the influence of alcohol or drugs. Okay, so if just have you count off in threes, 1, 2, 3, 1, 2, 3, and then remember your number.
And again,
1,
2, 3.
3, 1.
Great.
So, the ones go to meet with Stacy, behind you there at the table, and bring these 3 things, your pocket card and these 2 forms with you. The 2s will go meet with Kevin. And I'm going to go maybe 3 at that other table back there. Yeah. Have time for your survey, and I will stick around for any additional questions that people might want to ask.
Oh, yeah.
And so they actually
Yeah. Unfortunately, you know, sometimes
Where are you from?
bring up some writing.
Wow.
Yeah. So the way that we're gonna do this initially with the first activity, I'll play Savannah. And so essentially, I give you, give my screen, everything's negative, and for the most part, stay away from drugs now.
Yeah, Tyler's
So kind of, what would your reaction to that kind of, what would be your, giving some feedback?
And all the rest I would role play one and probably patient or one of them take turns in different roles. But right now, I'm going to be the patient. So I'm Savannah, and I've filled out my craft. I've probably here for well adolescent check, hopefully for HPV. That was right. I filled out my craft. And
Thanks, Savannah. So I
zero,
know
zero,
there's
zero,
craft.
pre-screen, no alcohol, marijuana, tobacco, vaping, other drugs. Totally negative craft.
So Savannah's stories here, and activity number 1 is that she has a negative pre-screen. and a
So what do you want to
negative
do? What do you want to
So
say or talk to me about?
How would we
alcohol or drugs?
Anybody that does it, and I've heard it so bad. Nobody means just kind of making sure that.
What would you say, Lee?
Yes, you, like, had your alcohol, you know, I'm like, oh, okay. What is important about lowering the goals that you're getting? I wanna.
What else a really good decision?
College. Yeah, I mean, she's thinking about, why she's gonna continue on her path, why she's doing it hard, and thinking of the time. So, does anybody have any other comments or actions or anything else that you might add?
Luckily,
No, it's basically the break.
kind of scared, but you know, in high school.
So what do you do?
Yeah, right.
One thing I'd say,
I've noticed
is
her
alcohol and marijuana, her friends are like,
alcohol, I suppose when I was 19, like, started like being late, I guess I like not drink it, you know, dump it on the ground.
Or in the car, everything in the vehicle, whether it's somebody like,
We're into a conversation on the situation, I would go and then.
And I'm like, this party, you know, I'm brand new here, so. I didn't really feel pressure. It felt like everyone was pretty cool, but you know, I don't know, like, my friend
I think that's a really good point, a perfect decision, because, you know, she may not have been exposed yet, but,
you know,
it probably will happen.
I really want to make some friends.
Yeah, great point. Awesome. Okay, so next part, we're just kind of going to go around. There's going to be someone who plays Savannah, someone who's playing the healthcare provider or educator, and then an observer. And if you're the observer, you're just going to kind of follow down the list and see kind of where people are going at, and then maybe using it as a guide if you get stuff, maybe giving some advice of, you know, pointers to you. And then we'll just go forward. So, anybody want to jump in and be Savannah?
ride home.
Okay. So this is for activity 2. So Savannah reports that she tried alcohol once,
All right, so.
last month when she was at a friend's house watching a movie, but her craft was 0. So what I do for this
All right.
kind of recognize you. Yeah, definitely, nothing like a mild, low risk, you know, craft is 0, but she is acknowledging
So that's kind of.
alcohol use. So, we have our Savannah, does anybody want to?
Positive reinforcement, right?
Of your friend, okay.
Okay, so now we're on to action.
And we're ready, have the cards go off of the
You need to play a different role each time. One
Hi, Savannah. How are you today? Good. So I thought that you filled out the iPad. I know that took a long time for you. I know, I'm sorry, but I'm really, really grateful that you filled it out. And I really appreciate it. And, so, you know, one of the things that I noticed is that, your photo scores were really low.
Damages and what they see.
But I will
always
always
not every situation needs to
I'm
resolve.
trying to feel it out.
But it's just to
So
kind of
one of
give
the
you a
things that I
chance
noticed is that, on your questionnaire, you had,
think about
written that you had been to the friend, and,
making sure
tried
that
what
what you guys are trying to show is something
is that right?
if you're the patient, you can be
Alcohol. So can you tell me a little bit about like what happened or like where, how you guys were doing, what were you watching? Tell me a little bit about that. I think it's,
Or we were watching High Net Worth Bread, and there was smoking weed on there, and there was drinking and stuff,
So,
and then she
when
was
you say
like,
your craft is teaching like self-vision, I would work with like,
okay. So you guys are watching this movie and you're kind of other people do it. And so your friend is like, oh, well, I have some ideas in mind, and so you want to try it out. It sounds like,
We'll do
yeah, it's pretty girls.
so you felt like it was pretty gross.
Yeah, pretty
So would it be okay if maybe I talk to you a little bit about, what I've sort of seen with alcohol use with teenagers? They only do it once.
and all of her.
You're right, you only did it once, so that's a really good point. And first, I want to praise you for that. I really want to commend you for the fact that you only did it once, because, I think there's definitely other cases where people do it more often than that, and so it just sounds like you were trying it. But we also know that there's actually a lot of things about like brain development that happen if you drink alcohol continuously, and I was just wondering if you
So,
Yeah,
a little something there, I don't want to.
So this is kind of like the part that just talks a little bit about, different alcohol use for teenagers being
Appropriate intervention more or less. From what you know so far about Savannah, with the 0 craft score and one time trying alcohol.
I think it's just kind of fun to look at tried it.
and I think you
Started
started
drink.
I always explore about like.
So I'm just wondering, like, do you know how much you probably tried when you had the wine?
I don't know, I kind of just break alcohol.
And so when you guys were taking it from the bottle, would you say that like you guys finished the bottle? Was it like a sip?
I don't know. 10 or something.
Oh, okay. And you know, it's like, okay. So it sounds like you drink, maybe a certain amount that actually makes sense.
Yeah.
Do you remember, did you throw up afterwards?
I can't remember. I just want my answer.
Your role is,
Do you guys remember if you
whatever your
finished
role
it?
is.
Health educator, medical educator?
I think so.
Yeah, you're not
Okay, this is actually, okay, it's hard to remember, yeah. Okay, so it sounds like you and your friend, it was, you know, you guys had a full bottle of wine,
It's either early and help her. they probably know it less number.
Okay. All right. And so kind of one of the other things that we see here, and I think it's really hard to tell if you're getting out of the problem, is that we don't really fully know how much you're getting.
Savannah, let's go.
I was just at a party with my friends and, that had alcohol in it. I don't know, you must have to keep on
If you're looking at the 5 ounces, I'm pretty sure, I bet it'd be a little easier. So if they drink, she probably has that's like 10 shots.
It was okay.
So anyway,
All right, so then for the next one, for activity 3, what I want to do is have somebody actually play Savannah.
probably
Somebody actually be the, I want to take out that, efficiency checklist and just kind of follow along and watch what the conversation's going and follow along with that and see. We're hitting those points, we're missing, afterwards, then we'll talk about it.
so that's kind of
So does anybody want to do Savannah?
Is that surprising?
Yeah. There's also, you're gonna be Savannah, so who wants to be the coach? The checklist?
So it would keep.
You know, so I know one of the things that you've emphasized a few times is that, so I guess one of the things that I'll do for you, like, what are your thoughts on alcohol? I feel like you're just one to win.
Yeah, you can fill that in.
Can I use your pen?
Mm-hmm.
Thank you. Yeah, I'd like to say that blank.
This is, what we know about Savannah, so we can we would bring up in the conversation here.
Yeah, I just like that you're asking. I think it's good to be asked.
Yeah, it sounds like that.
And
Do you,
providing
I guess I'm
support,
kind of curious, like,
telling
do
you
your other friends drink alcohol or?
I do, yeah.
No,
It's really
okay, so
good.
it sounds like it's really good. Yeah. Did you feel pressure doing it?
Savannah reports that she drinks.
Yeah,
Not really. So if you feel pressured again, and maybe, you know, like she gives you more wine and
Well,
you
this is the
feel
fourth one.
like your head really hurts,
Right now.
what are some options for you? What do you feel like you could do?
Yeah, we started thinking about that.
Her graph score is a 1, and the question that she scored 1 on was not the relaxed question.
Yes or no?
Don't you like drugs during relax and feel better about yourself?
Like what, she might have said yes, I really
I would say she's probably about moderate. You guys agree with that?
Well, what if she said, I really like you?
I agree. So we don't do crash.
Oh, what do you use?
They either help educate, they're in the classroom in the schools,
Okay.
so they'll get into a 1 because, because they've gotten in trouble or whatever. So,
it's 1 to 6, but 1 is moderate use.
no, it doesn't mean moderate use. It means that one of these questions here came up positive. They, 1 out of 6.
Yeah.
1 out of 6 is the question.
Yeah, they tried to, yeah, but this one doesn't count as part of the first one, right?
Well, so it doesn't, I mean, it does count towards the 6.
It does.
Right, but if they were to only answer the car question, you know, the rest of them, then we would look at maybe something like the contract for life
yeah.
or.
Usually what else that is, but it'd be an opportunity.
And so that's
He
where
does
the
need to
number 1
list what the things that we can just do. Another thing I tried to throw in there, and I talked to him about.
So, but knowing that, which if you answer one to the question, you're around 32%,
I tried.
chance that they're gonna have substance use disorder.
Yeah.
Once we hit 2.
I think what was super hard is you kept minimizing it. Like,
I know, you were definitely, because I think that's realistic, you know, you're gonna get a little resistance.
and all the times we do these, you know, we're actually, oh, yeah, I was thinking that's the point.
But once you get past one, you do look at it.
I'm trying to get off the launch pad, and you get in off the launch pad.
They did a really good job, and I thought they were really cool.
I don't know that. Really likes it.
I also like that you brought in that protective factor.
It's video.
It's kind of talked about, oh, what can you do in this situation, you know, save your skin.
I don't
No,
want to.
later.
I'm different thinking about it, it just comes up again with what I would do. But yeah, for this situation, I mean, for the most part, you know, going over the risky level, had a couple, but just kind of like that reassurance, you're doing good, but protective factor.
No more else.
That's a big head. Okay, so you guys feel pretty ready to have this conversation?
So now it's very good point. She's talked about once a month, 12 times in the past year. Her craft has a score of 1, which she doesn't ever use alcohol or drugs to relax. She said she does to relax, feel better about herself and fit in. Yeah, so we'll also do now is more, in terms of the level of, she has said,
Has used alcohol or drugs to relax, feel better about herself.
She knows she uses to relax.
The ones that I
You
work
also know you need to be thinking about that.
yeah.
So you can use those for less.
Put Savannah in there.
I don't know if we
Oh,
have a
that's
set.
right. I think it's over 2 or more on the graph. What kind of intervention do you think? Intervention or treatment,
Clarify that as well. It's just sort of, that's just to open the door, right? But with a score of 1 at any age, male or female, you would say this is at least moderate risk.
And then we
Perfect. Fine for following oh, I was just motivation to not have every intervention in the moment, but like having more real conversation.
Things.
yeah, so like that one was like a lot of which is yeah.
How did it go? How did you feel when?
Okay, so who wants to be our Savannah? Really good. How are you?
No.
Okay, so, and then if you want to go along with your server forms, you need to chime in or
For the rest
So
of us.
I noticed, on the iPad where I asked how many times you left here that you have,
And then
and you put down 12. So can you help clarify that for me? Is it 12 in the last 6 months, 12 in the last year, 12 in the last month? Yeah, okay. So about once a month, does that feel about right? Once every 2 months, okay. And, can you tell me a little bit more about what happened? Where did that go? And about when you do your information to relax yourself, can you tell me what's going on?
I haven't really they get angry.
Do you like it? What is it?
I don't know.
Like the way it tastes good.
I don't know.
I noticed that,
But at the same time, a lot of adolescents use it to cope with stress and cope with things that are going on in their lives.
yeah, can you tell me a
Is
little
there any
bit more?
problems that you've been having?
School-based Calculus.
Oh, no, you're 14.
Never mind timing.
Can I ask you about a couple of the risks that happen when you're drinking?
I mean, I don't know.
They're not fully
It's just like one of
I can't see people. They can go. That's kind of it, but
have shown that you do get 13 more. Are you drinking wine? So,
As your healthcare provider, I really, recommend that you don't chat out and everything that you do. What do you think about that when I say don't drink at all?
I can also try not, I know you're not driving, but it's gonna be more of those
I just do it.
my friend,
Yeah.
like, my friend, not be doing it.
So, I hear that you're kind of interested, that you would like to give it a shot, right? Okay, so on a scale of 0 to 10, 0 being, there is no way this is like when I then like, I am sure. Where do you think you are?
Probably
A 4?
Yeah.
Okay, so what makes you a 4 and not say?
Anything happen at school?
I probably won't tell them. But what is, really bad just has to be drinking at these. I have, I can do something for myself, not even
Hi,
guys.
Yeah, So in the interest of time, I want to keep us moving forward. So let's maybe say that, you have her weigh the pros and cons, right? So let's maybe, do the readiness ruler and then keep moving forward to the next step. And then we'll talk a little bit about,
A little contract.
how that went.
So it's a way for you to kind of put down on paper like what you agree to. Would you be okay with that? Okay, so I'm gonna grab the contract and then.
I wanted to start to figure
And I
out.
just wanna say,
Stop it.
for like, willing to give it a shot.
Ache or headache.
How ready are you?
It's like each person in comment, how does it feel to be something?
So what I'm hearing is that even though it may look good at the end of the day or the next day, it doesn't make you feel good. So, you see how that.
So I would follow up with, after you've asked her, maybe how important is it, she said 1. Then you can, just like you're doing, rolling with it, she's, not really, she's showing some kind of ambivalence.
Yeah, it seems like very real. Yeah. Very good, like, leading to an result, because you don't have an hour.
So
No.
when you said,
It's got about it, okay.
Do your, I love
I
that.
feel like I'm like.
so I would follow that.
Just that. No, like the way, determine regional security.
And so
So we also have.
from here, what do you think your readiness to?
So, and I'll follow up with,
I'm not
to the
changing.
follow-up, and I would love for you to
I'm ready.
at least spend a few minutes with the bond. Other activities.
Down about myself.
I feel like I got maybe a 5 or.
Already.
So again, in the interest of time, keep us focused, we still have one more to do, but based off of that, I would maybe ask her what challenges she might see, if she
Defending herself, why she doesn't want to change.
actually make a change,
Lower than she is.
explore a little bit right there.
Yeah.
Are you ready to
Moving
change
with,
if I do a 5 or 6?
helping her develop a plan.
I'm ready to change.
Oh, like, I mean, you, no,
And how come you're
it's a
5
pre-grade
and
on your
not?
graph.
I mean, because it's not like.
Bigger number for alcohol, how many, like 50 times or something. No marijuana, no other drugs. On your graph, you have now said yes to relax, feel better about yourself, fit in, and.
Okay, these are all DOS codes, and I had to learn them because I lived where I lived at Creek. But Control X will text, Control C is copy, Control R is
I would just try to shy away from that.
So what are
with the pros and cons I would have for
buy or that we could get on
so following it up with, so where does that leave you? Something along those lines. And then just make sure that
You're going to be our interventionist, so she would definitely still need this conversation, but what I think about what else she can do.
Actually do Monday on March
Fire, or whatever that is. And
And
all
then
of it, whatever
I
she
could work
feel
that
like you stop right away, and then you observe, and
Tuesday, Wednesday, Thursday.
you can do one of them.
And then
comment on it again about what's working, and other things we could try.
Okay.
But it also it makes them feel like they're listening to me, whether you agree or not.
All that information you gave us, would you mind if we go over some of your answers?
Yeah, that's it. Okay.
All right, good.
Well, I think
a lot harder for people with iPad and stuff.
This person right here, the scenario is a little bit different in how she answered the graph.
how often are
You want to be Savannah? Okay. So that's what we know about Savannah right there.
You were definitely my one, Corbis is awesome.
Like 3 or 4 parties a week, and then other times.
Like trying to point out all the different things. I know it's
And you said here's that. And then I'm sorry.
Okay, so Savannah reports that she drinks alcohol every week at parties, sometimes more than once a week. Once she thinks she might have passed out because she could not remember most of the party. Her crash score was a 2. She answered, yes, do you ever use alcohol or drugs to relax? Relax question, and do you ever get high? So where does that put Savannah?
I think that's just kind of, yeah. So, and are you happy with that, or are you going like?
Oh, yeah, great.
But I also think
Yeah, we had a lot of fun.
Okay. And.
Yeah, definitely, right?
Definitely, right? I feel like this is a hard one because
Already
she's really happy
two
about it.
yeses.
Do you have any desire to,
So knowing that,
decrease your drinking or change those habits at this point?
how would you approach?
I hadn't really there, whether or not.
Would it be okay if I asked you and kind of explore that a little bit more? Any desire?
All right.
So I am a healthcare provider, and of course, for my.
One thing I noticed
that we
Okay, bye. Thanks for covering. Bye.
drinking alcohol.
But from that perspective, what do you think about that?
Yeah.
But that's so that I, yeah.
All right, awesome job. And then we got one more. And this one, Savannah reports that she drinks alcohol every week at parties, sometimes more than once a month.
Sure.
Once she thinks she might have passed out, she cannot remember most of the time. She had a craft score of 2. And then, do you ever use alcohol or drugs to relax? And then, yeah, to fit in, and do you ever get more used to drink alcohol? So,
That we want
what
to be your
category are we in? Savannah
could give you more.
Like our line link.
And you've,
Typing it in there.
you know, how many drinks do you have at one time?
You're making it really hard.
If I, yeah,
Usually
that drink that much.
I mean, maybe I would close it out. Do you find if I pull out a card and point to you about alcohol a little bit? Is that okay? So I would go through, but I get where I would go. Okay, and then just confirm that which kinds of drinks.
Okay.
And then, and basically go better to
Can you tell me a little bit more about that?
Okay.
And then about, using when you're alone.
You know,
So,
she forgot.
Oh, she forgot, okay, so, you know, so tell me, so if one of those 3 questions, so tell me a little bit more about, so you indicated, so the question was, you know, that you're using alcohol as a relax.
Okay, good. Well, I noticed that you took some of the craft, one of the readings,
Tell me about that.
Yeah, and how long does that last?
I'm sorry about that. I know that can be really
You know,
frustrating.
another thing that happens a lot of times is
I thought we were gonna see my number here. Yeah, so it's just kind of job, I just wanted to come and introduce myself, and my job is to review that screen that you filled out on the iPad, and then just fire me right there to come and say hi to you afterwards, okay? So I just was wondering if it's okay for me to review some of the.
So have you ever, but I just don't know at that point,
Okay.
like
Okay.
would you do that?
So,
If
there
they
were
were
two things that stood out to me on the screen, I just wanted to.
So I would explore the graph,
Okay.
and then go from there, just move around for
Had,
getting.
reported, alcohol use.
Especially with girls, I mean, it's important, like, with girls, so.
Yeah, she's concerned. Or whatever. She's concerned because Kari's been taken a couple times. I know that she's any of these folks are. It wasn't today, I think it was.
No, it's usually on the weekend.
It's on the weekends, but not Sunday night, it's like Friday or Saturday.
Kyrie, she was supposed to be.
Yeah, the one of the house you're supposed to go in, you can always ask her at some point, but she's like, totally, no big deal, I'm fine.
Yeah. So that's where, this is the problem.
Oh, I'm sorry. And then you can ask her that way, and she's like, well, what happened? Yeah, so that's like 20. You're great.
Okay.
Is there a time you wish that you didn't drink like that over here? Like, I think about kind of pull that out.
Time, or you'd rather, yeah, so the having fun is more.
You want to forget.
Read it today.
And they might not ever tell you about it.
Yeah, so.
So weigh those, repeat back and say, so it sounds like on one hand you like, whatever you said, and then on the other hand you don't like the way that it makes you feel the next day. So where does that, follow it up, something like that? We just kind of elicit their response for it. And then based off of that, I would come back and say,
No, you did.
Yeah, the rapport was there.
Yeah.
Okay, yeah.
And she was talking.
I think I know who you're talking about.
Yeah, or for sure, and I don't want to get it.
right, and so that's where you elicit their response. Say, so what do you think about that information, that sort of thing, but just continue to
I'm not even sure if I like
I think something that we can talk about that once you go through the test.
Oh, yeah, that's what he
Well, I mean, it sounds like they're gonna feel you up in terms of that share more about.
You're not a little scary, even if at first, they're like, oh, and what makes the agree as opposed to the two or one?
Send it on, you know, I can text it to them. Right, PDF and that.
Held in.
Yeah, they don't start it and then go by or someone else.
And also, I mean, that's her following who I'm doing now. She has not wanted necessarily to engage.
We do, student story. We're all attending, yeah.
Especially when it's a kid.
She's not going to.
So then I think we just go into a harm reduction. How do you make sure you're safe for now, and maybe the life, to not drive, and I mean, maybe for that's probably it helps me to talk about it, or.
I'm trying to get it like motivated, like what would be incentive, or like what was like then, and how did what I want then. What would it look like
We want to see changes.
car accident or have someone.
Excellent. You think so?
However, alcohol might be affecting her, you know, like what are some cons that they have to deal with? And then the car figure out ways when they're impaired or you will drive. But I know it's kind of hard to use like if she's not that old. Well, so, but I also think with ride is important to establish trust before you really start trying to. Sure. And this one is the time is short. Okay. Let's say you just have like 5-10 minutes and you want to get at least somewhere along. Yeah. So then, but if you have like, if you have the time, it's
be able to dive into that. And that might even feel like you're working hard, like let's talk about this more, and then we'll focus on what you're doing.
And then we want to
But in the
focus on a
meantime,
goal
establish
to agree on.
the
You know, so
goal
maybe
of
that goal is
alcohol.
just as simple as, can we talk about this next time?
Yeah.
That's an easy goal, right? And like, we can meet that, and they're gonna meet with us.
Yeah. That's
No
what
matter
I
what,
said.
so try to focus on something like that.
Because,
Something else
but
that-
just for the
I think the
better,
next-
intervention was to see that brief intervention, how are we, you know, it's just kind of.
What would you say?
But honestly, like, yeah, that's why I like. So what do you think, as we're focusing on the alcohol, how would you move forward to kind of, she gave you a lot.
Yeah, so I would say something like,
Even if it's
I noticed that you're
there's not as much fight,
even up to 10.
you know, that goal can be like, can you agree not to drink tonight? Somewhere, maybe it's okay, you know.
How much, do you know how much each time?
So something positive that you know is attainable, and then focus on that, and then at the next time you meet, like, keep doing that until you have a rapport and you're out over time where you can say, well, you know, what some young people your age choose to do.
For you to pass out and then
Rather
that,
than
and then.
quitting altogether, maybe cut back on on the amount of alcohol.
Okay. So, I mean, I just have to say
Summarize
that
everything
it's moderate.
you said, and then that's the point, right?
Okay,
Really,
okay.
like, you're not gonna drink
I
Monday
wanted
through
to just be
Thursday.
really upfront with you and just let you know that that's accuracy
And what they can.
where there are a lot of concerns about that.
Exactly.
This is where it runs.
It's time check that it is one, so
Okay,
that people,
yeah.
do their, their post survey, but keep going if people don't have to rush.
Okay.
Just so we get the post survey.
Yeah.
I mean,
So that's how I would go about it. Any thoughts, you, or you, either one of them?
No, I haven't honestly done this. Sure, but I'm trying to put this into like nutrition.
You know, I think it'll be very helpful for
Yeah.
nutrition.
situations they've been in when they've said,
I used to be.
About give up something to you instead, so instead of just saying, hey, can you cut back, be like, hey,
I'm
what do you really like this? What you focus on this, you focus on this, next, I like that.
And then like, just start helping them, giving us that, like, deterrent.
Protective factors, after school activities, like that. The more you're kind of keeping them occupied, the less chance there are of them drinking as well. So it can be super helpful. I would also recommend, you know, checking out our online training, just as something, you know, that you can get some practice that way. We also have an app, if it doesn't have an app, like a module on it, and we're working on it.
and it can be pretty dangerous. So, sometimes there's really good, like, really good pictures about some of the risks of drinking that much. I'm just gonna review some of them with you, if that's okay. So during adolescence, so with that really.
You do have to feel the need, because if you don't feel the need, you aren't ready. And I'm feeling the need.
You know, we also
Your frontal lobe is actually, your frontal lobe is really responsible
questions
for
throughout the process.
your
and that
ability
sort of
to
thing,
slow things
pressures,
down and think about consequences and things.
No problem, thank you all.
Yeah. But still.
Even though when we're drinking, it's really helps us forget, usually after.
Like, great, doing expert in the clinic, to doing.
He was very receptive. Yes, he was easy to help. He was easy. I would agree.
I need to go back to the part and I'm actually
I'm gonna call him, seeing if he'd be willing to come back.
he's so receptive, I should do it.
Yeah.
I mean, do you think that alcohol might have been relating out,
We got a little time.
happened to you that was like a difficult to get out of that school?
I mean,
It's hard. It's easy when they're doing well.
Let's say you could tell us really, very articulated everything perfectly and cohesively. Yeah. I think the only thing I know that we were down all the time, but, just establishing some goals, like, complete. But again, feel late for another few minutes. But do you have anything like, as far as decision wise, like how is that on your end, how is that on your end? You could definitely get, kind of escalate, like, wow, I didn't realize how serious it was and what was going on. And, that absolutely could happen. And so, you start yourself, to manage that part of it, or you felt like maybe you're beyond your scope, kind of refer you to, and all that, kind of a list of available programs that you can.
Yeah.